Well, welcome everybody to this episode of Chamber Chatter. We're coming to you live from our Emery's Rock Realty studio here. I'm super excited to have Dr. and I'm going to mess up your last name, so why don't you share your last name? Because Sarah gave me, your wife gave me, but I still will mess it up.
It's okay. It's all right.
I'll hear it one more time from you.
So it's Dr. Firas, Alzaiem.
Alzaiem.
Yep.
Okay.
And they call me Dr. A. It's easier.
Oh, that would have been really helpful information to have.
It's a lot easier. I've been known with, by that, so it's much easier for patients and people.
So you're a medical doctor.
Correct.
With Elite Health, right?
Yes, Elite Health Wesley Chapel.
Wesley Chapel. I love the Wesley Chapel part of it.
Yep.
So tell me about Elite Health and about you.
Yeah. Well, thanks for having us. We
Absolutely.
appreciate that. We're from this area. Been here for quite a while. Wanda, my wife, that started the practice with me, has been here since she was 6 or 7 years old, so this is home for her.
And almost a native of Wesley Chapel. We don't have a lot of those.
No. It's not a lot. I mean, I would say at this point now, I can say I'm almost a native. I've been here since I was a teenager, so it's been quite a while.
I usually say the cows are the only natives of Wesley Chapel.
I would agree with you on that.
So you've got to watch this community grow too.
Oh yeah. Remember when Bruce B. Downs was just one lane each way, and 56 was like, that's far up there.
Oh, I know.
Yep.
Bruce B. Downs was, I used to call it the Wesley Chapel Audubon, because you could get on it and go as fast as you wanted to go without any traffic lights or anything that would happen.
I remember. I mean, I do miss the quiet, but it's really busy now. So it's the busyness of things, but it's great.
Awesome. So tell us, what kind of medicine do you practice? We were just having a little chat about the flu.
I know.
Before that, but
so I'm an internal medicine doctor. So I'm board certified internal medicine. I do a couple other things besides internal medicine that we can talk about a little bit more, but that's my main specialty. I was in hospital medicine for several years. I worked at a local hospital here I was a hospitalist, so patients get admitted. I'll be the one that would admit them and take care of them during those times. So it was great, but I felt like that was, as fulfilling as it was, taking care of patients in the hospital. I think there was a need for more primary care medicine that we were kind of, I would say, lacking in the community, given the fact that we're having tremendous growth here.
One of the fastest growing communities in the country.
Not surprised.
And it's incredible. And primary care physicians are always hard to find.
Always.
Are you accepting new patients?
I am.
I am. Great. Good to
know. And we're adding a little twist to primary care. So in our model that when we decided to go on our own and kind of open up our own practice, is we wanted to make sure we do something that makes it more accessible to patients and also kind of changes the way the current healthcare structure is run. As you typically know with insurance models, patients, it takes weeks, if not months, to get into a primary care doctor. It takes months to establish with a primary care doctor, and sometimes most doctors are not accepting patients, and that's why your first question was to accept patients.
Right.
So we decided that we need to do it in a different model, and our model is direct primary care. I don't know if you've heard of that.
I have, but please explain it, because I can't explain it to people, but I understand that it's becoming a new trend.
It is.
With primary care physicians, and it's something that is very helpful because a lot of people don't have health insurance.
True. And the health insurance right now, with obviously changes in healthcare and the healthcare structures, and also how insurance models are run and primary care doctors are run, it's making it very difficult for patients to get care. And the unfortunate thing that's happening is patients kind of delay care and delay going to the doctor for that reason.
And then they end up in the ER and then the hospital.
That's why we're needing more and more hospitals in this area.
Right.
So it's definitely been a change. So for us, we wanted to kind of, I'll say in a way, I don't want to say this is innovative, I would say it's reverting back to how medicine was. Essentially is when your doctor knows who you are. So we're taking out the middleman. We contract directly with patients, and patients pay a membership fee, like a gym membership. They pay once a month, and then we don't really talk money again for our services. So they pay that one monthly fee, and again, just like a gym membership, and then they get unlimited visits. If I need to see them 5 times a month, that's what they get. If I don't see them for 3 months, it's the same thing. But that way, they still have access. They can still get same day or next day appointments. Every appointment we have is 45 minutes long. Sometimes actually a lot longer.
Wow,
we talk a lot, so it makes it even longer.
That's crazy. You see your doctor for 45 minutes?
That's actually one of my shorter visits. Yeah, I do talk a lot, so that doesn't help.
Well, no, but patients, when you go to see a doctor, you want that time. You need that time. You deserve that
100%.
time as a patient.
100%. I mean, for a lot of patients, it does take a lot for them to actually get to the point where they go see a doctor because, people are busy. Life, work, kids, obligations. And by the time you actually go and make an appointment and you go sit down with your doctor, say, well, I want to talk to you about my blood pressure. I need my blood pressure medications, but I'm also having a headache. I'm having this. Sorry, we can only talk about your blood pressure today. You got to schedule another appointment for the other issues that you have. Well, that's a lot. You've already taken half a day or a full day out of work
Right.
for you to talk to your doctor, and now you're like, hold on, another visit in 3 months, 6 months? So again, that puts a lot of barriers on health, and people feel like, well, I'm not feeling ill, I'm fine, it's not too bad, I'll just let it, and sadly, you let it fester and it gets worse. So with this model, it kind of takes that out of the equation. It's like, no, what are your issues? Bring them in. Let's discuss it now. We might not be able to get it all done in 45 minutes or an hour, but you know what? At least we can tackle these things, and not just tackle issues that you're having, but work on more preventative medicine. I mean, as you know, that's a big thing.
It is, and I think the focus on preventative rather than reactive
Yeah.
medicine is really starting to happen.
100%.
So when you say you're not innovative, I think you are, because you realize that going back to the basics is what's so important in
Yeah.
medicine and for the care,
Yeah.
to keep people out of the hospital and keep them healthy.
Correct. And the other part of it is, and that's one thing that people misunderstand how this system works. They think that this is a concierge, right? Because you're used to 45 minutes with a patient. Oh, I'm paying for a concierge level. It's a bit different. And the reason that's different than concierge is the price. For a lot of the concierge, practices, you're talking about, $500 or $1,000 a month. This our model for example, and we're very transparent about our prices, because I think healthcare is not transparent and should be more
Oh my gosh,
transparent
it's
for patients.
unbelievable.
And that's the only industry that's very secretive. It's like, no, we'll tell you what the bill is going to be after you get the service. We don't accept that in any other industry.
Right.
But healthcare, it's the norm.
Isn't that interesting? Yeah,
It boggles my mind.
Mine as well. The healthcare model. I've recently had a hospital stay. Recently, it's been a year.
Yeah.
And I'm still getting bills, and I don't even know what physician it's for or what. I mean, it literally comes in the mail pretty much every day, a different bill.
Yep.
And I'm like, how do you know if this is even legit? If you saw this person, I mean, so the whole system definitely needs.
Yeah, no,
rehabbing.
100%. Even as a physician, honestly, we have no idea.
Right.
We truly don't. And the average patient thinks that we have control, or no, we don't. We're consumers like you are,
Right.
essentially, because it is.
So you're cash pay all the way.
So
across.
cash pay all the way, cost,
Perfect.
and our goal is not just to, again, the difference between that and concierge is our price is $150 a month, and that per person, and that gets them unlimited visits. There's no copays, no deductibles. They come in, see us, and they walk right out. So it's
Sounds amazing and
so
simple.
it's as simple as that. And again, there's no there's no hidden fees in addition to that or anything like that. It's very, again, simple, and that includes their primary care visits, annual wellness physicals, urgent care visits with us, telemedicine visits. So if
Oh,
the patient
perfect.
cannot come in and say, listen, before I came in, I had a patient that wanted to get on a phone call because she's not feeling well. Got on a phone call. She looks like she has an infection. It's been festering now for 8 days, so it's not viral anymore. We can identified it. I said, fine. She can't take time out of work. No problem. Here's your antibiotics. Went to the pharmacy. Took care of it in 10 minutes, and it was just a quick.
And then
phone
did
call.
you just chat for the next 30
It
minutes?
literally was. I would say 90% of our visits becomes chatter more than anything
Well,
else,
but-
because you know your patients.
Right, and you're building that relationship with them. And in
100%.
medicine and in any business, the relationship is what's so important, and having that opportunity to connect.
100%, because we, and again, I really hate to say that, but we forget about the human factor of medicine, right? Because to us, it's just like, okay, you're here for blood pressure, here's your blood pressure medication, move on. Medicine is not simple. Life is not simple. There's a lot more to it, because when patients feel comfortable with you, when they trust you, they open up.
Mm-hmm.
So it might not just be the blood pressure. Maybe the blood pressure is raised because they have underlying anxiety. There's something going on at home. There's something going on at work. If you come in and you just say, here's your pill and I'll see you in 6 months, they're not going to talk to you about that. They're never going to bring it up. But if they don't bring it up to their doctor, who else are they going to bring it up to?
Right.
So by even something as simple as, like not, again, 30 minutes of chatter, that makes the patient say, you know what, maybe this is a person I can connect with, maybe this is a person I can open up about, and maybe it's somebody I can help them with that they had no idea that I can help them with. So again, it doesn't take much to, yes, it might be just chatter, but for me, it provides a lot of value because medicine is not just simply blood work and medications and things like that. Sometimes it's just talking. And I would say probably 90% of what we do is reassurance and talk.
Mm-hmm.
But we don't do that anymore, sadly, because of how...
Well, because you're booked, you got to get as many in because your payments are lower from the insurance companies. It's all just a whole cycle. I call it the medical merry-go-round.
It is. I mean, listen, 5-10 minutes per visit, and you're going to go. And again, I'm playing the devil's advocate here from a doctor's perspective. It's beyond tiring. You're seeing 30, 40 patients a day, and then everyone is upset because you're late, and you're apologizing to every patient, and then all it takes is one patient to be having, I have chest pain, or I have this issue. Now your whole day is behind.
Yeah.
So burnout is very real in medicine, and that's why a lot of doctors, and I think we're going to see more and more of this opening up, because a lot of doctors are realizing also the value for themselves too. It's like, well, why did I go into medicine? I went to medicine to be able to help people. Because you always go back, well, they ask you why. Well, every pre-med student is going to say, because I want to help people. But then you go into medicine and you're like, hold on, this is not what I signed up for.
Right.
But you're too far in.
Too far in debt for medical school. Did you always know you wanted to be a doctor?
Yeah. Since I was a kid,
Really?
Always wanted to. Yeah, something that I've always enjoyed. I've always thought it's a field that combines not just obviously the human aspect of things, but also the science aspect. I mean, you can be able to bridge both.
Mm-hmm.
I think it's phenomenal to be able to say, you know what, I've always been a true believer that people do things because people don't just do things for no reason. There's always something behind it. When you talk to people, the passion, right?
Yeah.
So I think that there's a lot that can be done in medicine, and especially in this day and age, I think there's a big, and I hate to say that, there's a big distrust for doctors, right? It's like, oh, well, money-hungry doctors, they don't care about the patient, they don't care about that, and it's, from my side, when I talk to my colleagues that are in medicine, from hospitals to even outpatient, there are a lot of doctors that truly care, and they've just been put into the system that really burnt them out. Mm-hmm. And hurt them, and they always go back and say, man, I wish I could just practice medicine the way it should be. I want to help patients, and sometimes, say wrongfully, they do take it out on patients, and they don't, it doesn't always come out in their bedside manners. But I know there is someone out there, because you go back to how what made them go into medicine, they truly wanted to help people. So I've always loved that aspect of medicine, be able to take somebody who's not feeling well. Like today we had a patient we just took care of last week, and we do a lot of hormone replacement therapy we do a lot of menopause medicine, which is very underserved and undervalued care.
Very underserved, and the population here in Wesley Chapel, I will speak for all of us women of a certain age who appreciate the fact that we now have somebody. So let's talk about that.
Yeah. I love that, because it's such an undervalued, underserved area in medicine that again, from doctor's perspective too, we've just always brushed off, eat better and exercise. Oh, okay, thanks, doctor. Like, that doesn't help me, right? That's not. I wish
it's not fixing the fact that I woke up completely wet in the middle of the night and had to change my pajamas because of the hot flashes and the night sweats and all of that. So
it's unfortunate, and it's debilitating, and it's sad that half our population goes through it. Not just like, select few. Like, we put a lot of effort into diabetes, high blood pressure, even rare diseases. But when it comes to menopause, that we know every woman is going to go through that.
My generation, my mother and grandmother, nobody talked about it. It was taboo. It was something that was just kind of, you did it in silence, and you didn't. Now I have no problem sharing with people, like, give me a minute, I'm having a hot flash. I'm not going to take all my clothes off at this very moment, but I have a fan under my desk. For things like that. And the more we talk about it, I think the better we'll all be.
100%.
And so having those conversations, especially if that's something that you're focused on.
100%. I think it's just something that really should be done more about, because there's a lot of tools, there's a lot of things that we can do for women. So even as an internal medicine doctor, I mean, we train in hormones, we train in endocrinology, but at the same time, look back at your training, it's like, well, I had one lecture in med school about menopause. It's called menopause for 1 hour, and that was it. And I was like, do I really, like, that's not adequate? And again, we don't say the same thing about any other condition. We've had a lot more about some rare diseases I've had a lot more lectures on and a lot more training on. So I'm like, that's kind of interesting. So that's what kind of prompted me to say, all right, well, we're really dismissing a lot of these women. And this is a
again,
real
half the
pathology.
population.
It's half the population. So and it's not like if they're going to go through it, they are going to go through it.
Yes.
So it's just I wanted to get, again, more and more into it. So I'm certified a practitioner by the Menopause Society. So I'm certified by them to be able to treat hormones and do evidence-based. And what I mean by evidence-based is to make sure we do it affordably for patients, do it safely, and just do it ethically. So there's a lot that can be done out there, but not everything is right. And what I mean by that is sometimes women, because they're so desperate, rightfully so, they get taken advantage of. Mm-hmm. And that's kind of one thing that we don't like, and I really hate when you're at your lowest. The last thing you want to do, you pay somebody anything to do it.
Yeah, you're desperate. Desperate times call for desperate measures.
100%. And I've seen patients pay a ton of money just to get the menopause care that sadly sometimes, actually a lot of times insurance covers. And it's very affordable even without insurance from any local pharmacy or even online pharmacy. So again, we do a lot of menopause medicine. Not just the menopause aspect, but the medicine is one aspect. The other is the nutritional aspect to it, deficiencies to that. So the exercise, the diet, a lot can be done. It's a very multidisciplinary aspect to menopause. It's not just here's your pill, here's your patch, and have a good day. There's a lot more to it. So I love doing menopause medicine because it's like that patient that we had last week. When I say I see women cry, they truly do, because it's that debilitating. And you take somebody who's feeling that way, and a week later, like, oh my God. And again, it doesn't always happen fast, but oh my God, I noticed a difference. So that to me, it's personal satisfaction,
right.
Because like, okay, you've actually made a difference. It could be, to me, it's small, but to that person, it's their life. I mean, that's a big deal. And I love seeing that with women because to me, it saves marriages, it saves lives too. I mean, we do know that the hormone replacement therapies are not just about hot flashes, not just about brain fog or weight loss or just feeling better, but also about prevention of UTIs. There's a lot that can women die from UTIs.
Yeah.
So sadly, it does prevent death, and it does help. So there's a lot of phenomenal studies out there, and again, being up to date on these studies and being up to date on the tools that we have to help women is definitely, to me, it's a game changer right now.
That's so awesome, and I love that you're focusing more on that. So when we first started talking, you said you've been here since you were 16 in Wesley Chapel. The area.
Yeah. So so since a teenager, went to USF with Wanda. Went to college together, and we've been here since then in Tampa Bay area.
And so you knew you wanted to come back and practice here in this community.
That was our goal. Our families are here, so we're families, siblings, cousins. So we wanted to be in this area. We live in Wesley Chapel. We have 3 kids, and
raising your family. Isn't this the best place in the world? I love Wesley Chapel, and this whole entire community is just awesome, and just watching it grow, and we're all growing together. Which is just like an ecosystem of our own. And so
I love it.
Having a physician like you in our community is very important, especially with all the growth and, like I said, being one of the fastest growing communities in the nation.
It is. It's phenomenal to see the growth in this area. It's amazing.
We're very quickly becoming a healthcare hub. I believe, I don't quote me if I'm wrong, but we have every discipline of medicine right here in Wesley Chapel now.
We do.
We didn't have pediatric neurology, but now with Johns Hopkins coming, we're going to have that. So we've got the whole scope of everything here in our community.
No, I think that's going to be, it's very exciting. I think that's the thing we're missing here is a big pediatric center, and that'd be very phenomenal for us. So I'm really excited for that. That's a good thing.
They have a live cam where you can watch the building actually going up out of the ground for Johns Hopkins. So you should take a look at it. It's really cool.
Oh, that's awesome.
Yeah.
No, we don't live too far from there, so we drive by.
Oh yeah. So you see it. So you see the live action
I've been seeing the growth
as you go by, and then there's supposed to be some other medical innovation happening right just north of that in the Double Branch area as well. So
more is needed. I mean, with many people are moving here, it's I mean, the calls that we get to the office right now are people that haven't even moved here yet.
Yeah.
And they're like, "Oh, I'm moving here in 6 months. Can we sign up?" I'm like, "Sure."
Absolutely.
Like, it's not, but people are kind of planning ahead, and so I would say a good number of our patients are actually people that are moving to the area and ended up signing up before they moved to establish. So it's kind of phenomenal to see the growth.
Right, I know. And as the chamber, it's so exciting because not everybody in the country has this kind of growth. A lot of communities are already built.
Yeah.
And I get to share, hey, we're having the 4th hospital come out of the ground in 13 years.
It's amazing.
I mean, who gets to do that? And to watch it, I mean, yes, we're losing some of our green space, but I think we've done a pretty good job of protecting that.
Yeah.
But it's just such a vibrant community to live, work, and play.
100%.
And you're a testament to that, raising your family and investing in your community.
No,
so
this is
tell
cool.
everybody where you're located and how they could find you.
Yeah, so we're Elite Health Wesley Chapel on 30750 State Road 54. We are off of 54 past Curly Road, where the new Advent
Yep.
ER is.
Yep.
Meadow Point right before that on the right.
Okay.
Right around that corner.
Right by, I think there's a car wash. Right
Well,
before,
which car wash?
I know, right? That's a whole nother subject. We just did.
Like,
I walked
specify
right
that.
into that one. I really walked right into
Next
that
thing I say
one.
is a storage place. I'm like, yes.
Yep, right next to the storage place and the car wash and the gas station.
And a chicken.
And the chicken, yes. Yeah, I know. We know where you're at. And we'll put your address on the end of the podcast. And you
Yeah.
guys on social media where people can find you?
Yeah, well, we are. We're Elite Health WC on Instagram.
Oh,
So,
perfect.
yeah.
Okay.
Yeah,
Well, they'll
we're-
follow along. And anything else you want to talk about? I know you said you've got some other things that you guys do in addition to just primary care. You do the hormone replacement therapy.
We do
and then-
weight loss as well. So we do a lot of physician-directed weight loss. We use GLPs and non-GLPs. So we are very hands-on with our patients. We have an in-body machine in the office that we do scans on for patients before they do the weight loss, so we can keep an eye and monitor the muscle mass, build up percent body fat. So we're very technical when it comes to that because I don't want to just like, here's a medication and do what you do.
Yeah.
We're very hands-on when it comes to not just the medication itself, but also the nutritional advice as it goes, and also making sure they're doing everything else that they're supposed to be doing.
Well, it's
So-
kind of a new product, if you will, and you don't know what the side effects are just yet, but if you're keeping track of it,
100%.
you're probably...
It's things that really should be monitored and not just take. I mean, now with internet access, it's much easier to get and just take it yourself. And there's people that do that, but cannot advise that because I've seen the good and the bad that can go with it. And to me, it's still a medication at the end of the day, and it's something that really should be addressed because there could also be other reasons why you're not losing weight. There could be other ways that we can also help you lose weight that are thyroid issues, hormonal issues. So there's other things that a doctor can help you navigate through.
And that you could decide that during your 45-minute.
What?
That just blows my mind. I mean, seriously, my doctor's appointments are like
Yeah.
10 minutes, if that.
No, it's it's definitely a change. But even for me, and I still do run over my appointments.
Well, oh my gosh.
Well, it's different when you know the patients. It's very, again, it becomes a different visit because my patients bring me coffee in the morning. I mean, I've had patients bring me everything from coffee to dessert to eggs and strawberries. So it's like, it goes back to that whole old doctor feeling, right?
Right.
Like, when you're,
Yeah.
you're a primary care doctor. So it's kind of funny how that kind of went back to that. I'm like, I love this. This is awesome. So like, you really get to know your patients. So.
Well, you're very clearly passionate about medicine and really helping your community. So what do you do for fun?
Oh, all right.
See, I always stump the doctors with that. They're like, what? What do you mean for fun? This is what I do for fun.
So honestly, a lot of the time off that we have, we love to eat out. We love food.
Talk dirty to me.
We love food.
What is your favorite restaurant?
Oh, okay. Tory Bar. Have you been there?
No.
South Tampa?
No,
Oh
tell
my
me.
God, that place
Is that the
awesome.
new tapas restaurant?
It is tapas. It's a Japanese fusion.
Okay.
Their food is amazing.
Okay.
Roca.
Oh,
I love Roca.
love Roca.
The tableside mozzarella.
Oh, yes. I had that, and that's all I had for dinner.
Oh my it's so good. That place is phenomenal.
Scrumptious.
Oh my God, Sunda,
Nope.
Midtown.
Okay.
It's a Filipino. I think it's Filipino fusion.
Man, you're giving me a
Yeah.
whole new
Oh,
list.
we can talk for hours about
Yeah.
food, and that's that's what I'm hoping for more and more in this Wesley Chapel area, to get more of these restaurants.
Yeah.
To open, not chains.
So I'll share the Chamber of Commerce message on that is we are unapologetically a high rent district, which means the only people that can afford to have restaurants here in Wesley Chapel are the chain restaurants. However, that is changing, and there is a concerted effort to bring more of the standalones
Yes.
to our community. And yes, they're coming, and we're excited and welcoming them, but we can also travel a little ways to
We do.
to go. And I love food too, and all of the restaurants. I'm surprised how many restaurants there are that I haven't even tried.
Oh, there's just, I mean, there's an abundance of restaurants in Tampa Bay, and I mean, we travel just to eat.
Right?
Yeah.
There is nothing
we
wrong
love
with that. Embrace it. There's no shame in that game whatsoever.
No, I don't have an expensive hobby and not into cars.
No,
or
my
watches
expensive
or
hobby
anything.
is food.
For me, it's food.
Yeah, I don't.
For me, that's I'm happy if we eat.
Yeah,
That's it.
exactly. Oh my God, I love that
It's
so
done.
much. And,
Yeah.
and that's, I interviewed an OBGYN the other day, and I asked her that question. And you want me to tell you what her answer was?
Uh-huh.
Electronic dance music. She goes,
That's awesome.
I know, right?
That's
I was
awesome.
like, she was like, EDM. I was like, oh my God, that's great.
That's awesome.
Right?
For me, as long as we have something booked for the weekend, I'm like, we're going to this place. We're gonna go eat there. I'm half satisfied. I'm like, I have something to look forward to this weekend.
Yes.
We're gonna go with our friends, and we're gonna go have dinner. That's it. I'm
Perfect.
very
I
happy.
know. Food fills the soul.
Food is great. It's amazing. We go to comedy shows. We go to food. We're pretty kind of laid back. Just family
Enjoy-
time.
yeah.
We love that. So this is our passion. Like I said, this is our hobby. It's eating out and spending time with family and friends.
I love that. Well, it has been a pleasure chatting with you and getting to know you. And we're so glad to have you here at the Chamber and have you in Wesley Chapel to be able to provide these services. And thank you for raising your family here and serving us. And we look forward to seeing you around.
Thank you so much. Thanks so much for having us. Really
Absolutely.
appreciate that. It was a pleasure.
Awesome.
Thank you.